Hello, this is Dr. Bartlett here from backfit.ca. Our mission is to create the most informed, educated, and empowered patients in healthcare. And our intention is to move our community towards better health with bringing cutting-edge information on how to eat better, move better, and think better. Now for today, I'm going to talk about back pain. Now you may be aware of this or not, but back pain has become a serious problem in our society. It's costing our country billions of dollars per year, and a big demonstration of how we're knowing it's getting worse is it's now become the #1 reason for seeing a medical doctor. It's actually beat out the common cold. So what's more important for you is it's predicting that it could affect 80% of you and your family. So let's dive into this topic a little bit better so you can understand why we're facing this pandemic and learn some simple tools at home that can prevent the problem from occurring in the first place. So I have a question for you. What do you think is the leading cause of back pain? Now it seems like a simple question, but it's actually not that easy to answer, and everyone has opinions. And today I'm going to give you my opinion. After 10 years of practice, I've deducted one reason on the leading cause. And what it is, it's gravity. Yes, gravity. Now I don't think anyone can argue with me that gravity is a constant force in our body. Basically, from the moment you get out of bed to the moment you lie back down, it's compressing us to the floor. Now the problem is we don't feel it, but it's always there. So what we need to do is figure out a way to limit this pressure on our body. So I'm going to go through 3 quick tips. Tip number 1 is you need to be conscious of your posture. And I know you've heard this before, but let's explain this a little bit deeper. Ideally, your ears should be over your shoulders and shoulders should be over your hips. And why I'm saying this is because every inch you go forward or every inch your hip goes forward in front of your shoulders is accelerating the effects of gravity. So you need to be aware of that and be conscious of that. Now, number 2 is at home or at work, you need to make your environment around you conducive to limit the stress on your body. And what I mean is, let's talk about the computer. If you have a laptop computer, and I'll stand sideways, and if I'm looking down at my computer, you can see my ears are forward, which is accelerating the compression of my neck. And if I sit in my chair and collapse, I'm accelerating the compression of my low back. So 2 things you can do that can make a big difference is get your computer screen up. And ideally, we teach our patients that your eyes should be at the middle of the computer screen. Now for your back, get a pillow or get a back support that promotes the proper curve in your low back, and you can see it pulls my shoulders over my hips. So that is something simple that can make a big difference. Now third, I don't care if you sit on the best ergonomic chair, whatever chair you're sitting on, if you sit more than 15 to 20 minutes, you are compressing your spine. So you need to get up, and what I recommend is putting a little alarm on your computer if you work 8 hours a day that reminds you every 20 minutes to get up, walk around, decompress a little bit, get back down and sit, and that is going to help limit the pressure on your spine. So just to reiterate, you need to be conscious of your posture. You need to make your environment around you work for you to limit the stress on your spine, and you need to get up every 15 to 20 minutes, because I'll say this again, gravity is constant, it's happening every day, you don't feel it, but it is the leading cause of our problem, so you need to be aware of it. So this is Dr. Bartlett signing off. Again, our mission is to create the most informed, educated, and empowered patients in healthcare. Be good to your back because it's your biggest supporter.